So anyway, we'll start out with the MS in Public Health Nutrition, and then Dr. Hand will talk about the Combined Dietetic Internship Master's Degree Program. Then we will hear from Mrs. Bayless about the University Hospitals Program, and Mrs. Allen about the Lewis Stokes VA Medical Center Internship Program, and then we will finish up with your questions. So a little bit about Case Western Reserve University. We are in Cleveland, Ohio, and according to those who think they know, U.S. News and World Report, we have been one of the leading independent research universities in the nation for a number of years running. We rank first in Ohio and 37th among national universities when they rank research universities. And we have fantastic programs in engineering, law, medicine, dentistry, nursing, management, and liberal arts. And our student body is just over 10,000 students, and they come from all 50 states and 91 countries. So it's kind of a fun place to be because of our diversity. Our department was started over 100 years ago in 1913, not exactly where it sits today, but we are housed in the School of Medicine, which is a little bit different than a lot of nutrition programs across the country. We have a very strong research emphasis because our university is a research institution. We have been building a lot recently and have some very nice modern learning spaces. One of the gems of our learning areas is the Health Sciences Library with lots of resources for our health sciences students, not only nutrition but medical, dental, nursing. We have a PA program as well. And we are a smaller university, so we have smaller classes and a high faculty to student ratio. So when you look at the programs that are internships receiving their master's degree from our department, they kind of fall into two buckets. We have the Combined Dietetic Internship Program, master's degree program that is the interns from University Hospitals Cleveland Medical Center and Lewis Stokes Cleveland VA Medical Center. And those internships are based in the hospitals, so the supervised practice is primarily in the hospitals. And their concentration is research processes and applications. And those students' degree, when they complete the program, is an MS in nutrition. The other bucket of students is those enrolled in the MS in Public Health Nutrition Dietetic Internship, which is housed at the university. And the supervised practice or internship rotations are based in community sites. And our concentration is public health and community nutrition. The other difference is that the degree is an MS in Public Health Nutrition. There are commonalities. Both programs are 16 months long. Both programs start in August and end a year later in December with a formal graduation ceremony that we hold just for our interns. Our university is small and we only have one graduation ceremony a year. So we do a nice ceremony for our interns in December. Both programs lead to a master's degree and eligibility to take the RDN exam. All of the programs have some overlapping coursework, and the programs are both non-thesis. To graduate with either of the master's degrees, it requires a minimum of 30 credit hours in total. 18 of those must be in the nutrition department at or above the 400 level, which is the start of our graduate level coursework, as well as a minimum cumulative GPA of 3.0 or above, and successful completion of a comprehensive examination, which is given near the end of the academic program in November of the second fall. So why do we think you should choose a master's degree program with your internship? A variety of reasons. An RDN with a master's degree functions at a higher level in their position of employment. They can demand a higher salary. The Academy of Nutrition and Dietetics Compensation and Benefits Compensation and Benefits Survey, which is conducted every 2 years, proves that RDNs with master's degree earns more. RDNs with master's degrees have a stronger understanding of the research process because even though not all of the internships have a research concentration, they certainly do understand the research process and spend a lot of time evaluating the research literature. More likely to contribute to the knowledge base of nutrition science, usually can advance more rapidly in the field, and you would then already be prepared for the 2024 mandate that all entry-level RDNs have a master's degree graduate degree at the time of taking the registration exam. So again, we've got 3 different programs that you're going to hear from tonight. We're going to start with the public health program, and I'm going to tell you a little bit about that. So again, I'm Tammy Randall. I'm the director of the MS in Public Health Nutrition Dietetic Internship, and I am quite proud of our program. The degree itself was first offered in 1941. It was the first MS in Public Health Nutrition offered anywhere in the U.S. It was actually created in response to a lot of our young people going off to war and being malnourished and not being able to perform adequately in battle. And so we were looking at how to keep soldiers healthier and need a degree focusing on public health. And so that's how it started. All along in kind of the public health world, students would do what we called field work, which is kind of the same as supervised practice or the internship. We weren't accredited as a dietetic internship until 1986, but that was more of a formality. We had always been doing the supervised practice. It, again, is a 16-month program, 4 semesters, fall, spring, summer, and then 1 more fall. And we're accredited for 14 interns total, which means we have 7 openings each spring. Obviously, if we're the MS in Public Health Nutrition, we have a public health and community nutrition emphasis. The largest block of our hours is then conducted in a public health facility, where students will spend 12 weeks during the summer at an out-of-town public health agency, and we have a variety of options across the country that you can choose from to go visit and practice. And the students during that time function as honest-to-goodness public health registered dietitian nutritionists and complete a community needs assessment before they go, and then an agency program assessment when they are there. So what does the kind of format look like? In the fall of the first year, this is where the programs differ a little bit. The public health students are in classes only. This is where we have our heavier load of coursework. You'll take 13 credit hours. Spring of the first year is when supervised practice begins with classes on Mondays and, depending on the electives that you choose, perhaps also a weeknight. Summer is when you go away out of town for that block field experience, and it's Monday through Friday. And then you return back to Cleveland for your second fall or your last semester, and classes again will be either on Mondays or weeknights with your internship Tuesday through Friday. So the first year, what do you take? You take Intro to Public Health Nutrition, Seminar in Dietetics 1, which is kind of an advanced medical nutrition therapy class. I know the title isn't very descriptive. You take Nutritional Epidemiology, and then you have the option for an elective. In the spring, the course load is again a little bit lighter. You take Public Health Nutrition Field Experience, which is literally your supervised practice internship experience that you get academic credit for, and then an elective. In the summer, Advanced Public Health Nutrition Field Experience is that block field experience 5 days a week for 12 weeks in the summer. And then in fall of your second year, you take Pediatric Nutrition and the last course of internship or supervised practice as Specialized Public Health Nutrition Field Experience, when you get to make some choices about the rotations that you will be assigned to. So we talk about this 12-week block field experience. Here are some examples of where students have gone in the last couple of years. We have sites literally from Utah and Arizona all the way to the East Coast, Boston and Atlanta. I don't have anything in California, Oregon, or Washington right now, so I can't say from coast to coast. But we have state health departments, as you see on the list. We have also some larger city health departments. We had a student this summer at the New York City Department of Health in New York City. And we have a couple of large county health departments that are options, as well as some federal programs, the Centers for Disease Control and Prevention in Atlanta, and 2 USDA Food and Nutrition Service regional offices, one in Boston and one in Chicago. And we have these sites all set up. The students are able to choose based on their interests compared to the strengths of the program. All of our interns complete rotations similar to hospital-based internships, and that they do an acute care rotation. We just use the Cleveland Community Hospitals. We also use some long-term care facilities. We complete a counseling skills rotation where you have the opportunity to really build your rapport with patients and not have to worry as much about the content of the education or the assessment, because in the acute care setting, sometimes you're a little bit more worried about whether or not you know what the patient has and whether you're giving the right education. We try to allow you to have a little bit more time to learn your style in a more low-risk situation like a WIC clinic, wellness center, or outpatient clinic. We do a food service management rotation either in a school or long-term care facility, depending on your interest. We do a community rotation at either the Hunger Network of Greater Cleveland or the Greater Cleveland Food Bank. And we do a short research rotation. We don't have a research a research concentration like the other two programs, but we do have students do a 4-week research rotation, either at our Prevention Research Center on campus, which is a CDC-funded center, or within our department with faculty who are doing some research projects of interest to our students, or in the Department of Gastroenterology and Liver Disease, we have a dietitian who really likes taking students and is doing some work with the gut microbiome. One of the nice things about our curriculum is that we have the option for students to complete a certificate in maternal and child nutrition. And basically what we do is every time it said it said elective, if we choose those electives for you, it will end up in you earning a maternal and child nutrition graduate certificate that is actually on your transcript. And there are a variety of choices of classes. The two that are required are nutrition for pregnancy and lactation and pediatric nutrition, which our students already take. We also have the option for students to take nutritional care of the neonate, which is a really cool class where you go into a NICU and you are assigned an infant to conduct a case study on over the course of the semester. We also have a pediatric obesity class, and we just added, and I forgot to put on here, a human lactation course. So if you are interested in maternal and child nutrition, you have the option to complete the certificate without adding any graduate credit hours. We also try to focus your internship experiences on that population of interest. When students are finished, our graduates are qualified to take the RDN exam. We have a 95% overall first-time pass rate. Our graduates are employed. We have a 100% employment rate within 6 months. And they're active members of professional organizations. And I have the logos of our district, state, and national association up there because we have graduates who are in leadership positions in all 3 levels of our professional association. Some of the roles that our students have taken on after graduation, you can see on the screen. I won't read them to you, but we have students who end up in all areas. We are a community and public health focused program, but I think as the other internship directors will concur, sometimes in your internship you figure out what you don't want to do more than you figure out what you do want to do. And so sometimes our students decide, oh my goodness, they fall in love with food service management or something like that, and we have clinical and we have public health and community, so our graduates are employed in areas across the board of our profession. And the nuts and bolts of the finances, currently our tuition, the total program is around $54,000, but we do have a tuition stipend of $15,000 that each student beginning in August will have the opportunity to apply to their tuition bill in the spring, summer, and fall semesters. So that helps alleviate the burden a small bit. So for applications, you apply to Case Western Reserve University via DICAS. This is where it gets a little confusing because all 3 of these programs are affiliated with the university. But if you apply to Case Western Reserve University via DICAS, you're applying to the public health program. Mrs. Auna and Mrs. Bayless will reinforce that if you want to apply to their programs, you need to apply to either university hospitals or the VA. There's no need to apply to our School of Graduate Studies right up front. All you end up doing is spending the money, and if you don't match here, you gave our university money, which perhaps I should be more happy about, but keep the money in your pocket, and after you match, then we have you apply as a formality. We won't match anyone who would not be accepted to our School of Graduate Studies. If you have any additional questions, there's my email address and my phone number. Please don't hesitate to give me a call or send me an email, and I will do my best to answer your questions. If you would like to come visit, also let me know and we'll set something up so you can kind of tour the campus. So without further ado, I'm going to actually turn over the program to Dr. Hand, who is now unmuted, and she is going to talk to you about the Combined Dietetic Internship Master's Degree Program affiliated with University Hospitals and the Cleveland VA.
Great. Thanks, Professor Randall. Good evening, everybody, and thank you for your interest in one, two, or all three of our wonderful programs at Case Western Reserve University. So I'm going to talk about the master's portion of the Combined Dietetic Internship Master's Degree Program. It is required if you match to University Hospitals or the Lewis Stokes Cleveland VA Medical Center that you take the master's degree concurrently at Case Western Reserve University, because some of the classes are specially designed to meet competencies within the dietetic internship. So the programs are very closely aligned. I'm going to talk about the master's part, and then you'll hear from the program directors about the dietetic internship part. So we are really proud of our relationship and our strong history of collaboration between Case Western Reserve University, University Hospitals, Cleveland Medical Center, and the Lewis Stokes Cleveland VA Medical Center. Here's some pictures of the facilities on a nice sunny day in Cleveland. And you'll get this information at the end of the webinar, but in case you needed one more reminder of which programs we're talking about, the UH and the VA programs go with the Masters of Science in Nutrition that I'm talking about right now. And there's contact information and websites on this slide. So we're not quite as old as Professor Randall's program, but we are also proud of our history because in 1965, Case Western Reserve University combined with University Hospitals, the Lewis Stokes Cleveland VA Medical Center, and Mount Sinai Hospital, and established a program to complete the dietetic internship and the master's degree concurrently. And so we were actually one of the very first hospital-based dietetic internship programs to require graduate coursework. So we have a long history of preparing dietitians with their master's degree, and as we look forward to the entry-level master's requirement, we think that we're well equipped to keep training excellent dietitians. So we also have a 16-month program. In the fall of the first year, you take classes on Monday. You'll be at Case Western all day long on Monday. And then you're at your internship sites, one of the two affiliated hospitals, Tuesday through Friday. And we'll talk more about the research processes and applications concentration in a future slide, but one of the classes that you would take during the fall of the first year is a research methods class just for the dietetic interns, and in that class we implement a standardized research project. The spring operates much the same way. You have classes on Monday and then internship Tuesday through Friday, and one of the required classes again is a research class, but this time you get to develop your own individual research project. Once classes end in early May, for May, June, and July, you have internship Monday through Friday. And then when you return for fall, the second fall, you have classes Monday through Friday. So I've already told you about the two required research classes, but let's talk about the other required courses for the first two semesters. So in fall of the first year, you take the same seminar in Dietetics 1 that Professor Randall mentioned as an advanced medical nutrition therapy seminar, and the investigative methods in nutrition. And then in the spring, you take another not very descriptively named course, Seminar in Dietetics 2, but this one really focuses on leadership, business, management, and entrepreneurial skills that we think are important for dietitians. And all four of these required classes are limited to dietetic interns, either in the combined program or in the public health nutrition program. And so we're really proud of the specialized training that we give to dietitians in these classes. And then when you return for fall of the second year, You have 15 credits remaining to complete your master's degree, and all of those are nutrition and graduate level electives. So only 15 of the 30 credit hours for the master's degree are required. The rest are electives, and I won't read this side to you, but I just like to highlight what a broad list this is. You know, we have a very strong biochemistry side of the department, so if you're interested in basic oxygen and physiological function, you can really dig into the biochemistry side. If you're interested in counseling and behavior change and food behavior, we have classes on that. We have classes in dietary supplements and integrative and functional nutrition. You can dig more into the research side. So there's lots and lots of options for these elective credit hours. Let's talk a little bit more about the research emphasis. The goal of our research processes and applications concentration is to promote dietitian-led research and contributions to advances in nutrition science, and really empower dietitians to have an evidence-based practice. So I've alluded to this a little bit already, but in the first fall, we realized that not everybody comes in with a huge amount of background in research, and so the students participate in a standardized research project as a class, and this gives them exposure to collecting and analyzing data. And this is a class that I teach and really enjoy teaching research methods to the students. In the second semester, the spring, you have the opportunity to develop your own research protocol so that you can understand how research works in an area of interest that you've discovered in the first semester of your internship. There is not the requirement that you actually implement this project you've come up with. That is optional in the second fall semester. So some students choose to use some of their electives on independent study credit to actually act as a research assistant and implement their own project, and some end their research participation in the spring, and they are empowered when they go into the workforce knowing that they could write a protocol and could complete the ethics application should they want to do that. So program outcomes, our students are able to publish and present research. They're qualified to take the dietitian exam. They become active members of professional organizations, and they become employed. Mrs. Auna and Mrs. Bayless will give you some data to back up those assertions that I just made. Our graduates have found employment in a variety of settings. We certainly have great relationships with all of the Cleveland area hospitals, and many of our graduates either are from Cleveland and want to stay or fall in love with Cleveland when they come, and so they want to stay. We also have a network of alumni at pediatric, community, and academic medical centers and VA medical centers throughout the United States, as well as people who are working in the food industry, in therapeutic nutrition, at the Academy of Nutrition and Dietetics, and in academia as university faculty or researchers. So the cost of our Master's of Science degree based on the 2018-19 tuition and fee schedule is about $50,000 across the 3 semesters. We do not offer a tuition stipend because there is a stipend that comes from each of the hospitals, and so to make things balance out, Professor Randall's program offers a tuition stipend, and we offer a stipend through the hospitals. So if you are intrigued by this program, you need to apply on DICUS and D&D Digital to either University Hospitals Cleveland Medical Center or the Lewis Stokes Cleveland VA Medical Center. If you apply to Case Western Reserve University on DICUS, you will be applying to the Public Health Nutrition Dietetic Internship that was described earlier tonight. Like that, like Professor Randall said, though, you do not need to apply to the Case Western Reserve University School of Graduate Studies until after you are matched to one of the collaborating dietetic internships. So you can apply after you are matched to a program. We don't admit people to the dietetic internship who won't be able to get into the grad school. So we pre-screen you and you will be automatically accepted. And at this point, I'm happy to turn it over to my colleague, Mrs. Gina Bayless, who is the Dietetic Internship Director and Clinical Nutrition Manager at University Hospitals Cleveland Medical Center, and she will give us some more information about one of our partner hospitals, the UH Dietetic Internship. Thank you.
Okay, thank you, Dr. Hand. As mentioned, I'm Gina Bayless. Tonight, I'll provide you with an overview of the University Hospitals Cleveland Medical Center Dietetic Internship Program, and I have listed here some of the key points that I will be covering. The University Hospitals Cleveland Medical Center Dietetic Internship Program is based in a large teaching hospital which has been in existence for over 150 years. It's well established as an academic medical center and one of the nation's leading healthcare systems, as it has been recognized continuously as one of the nation's best hospitals and one of the nation's best children's hospitals by U.S. News and World Report. The Dietetic Internship Program at University Hospitals was founded in 1933. We are the second oldest dietetic internship program in the country. Our program includes almost 1,600 hours of supervised practice, which is completed over a time frame of 49 weeks, typically beginning in August and ending in July of the following year. We accept 5 dietetic interns annually, and our dietetic internship program is housed in the UH Digestive Health Institute under the Center for Clinical Nutrition. And here you'll see a photo of our original freestanding hospital, which is Lakeside Hospital. This later grew into the current University Hospitals Cleveland Medical Center. And right here at Lakeside Hospital, the Academy of Nutrition and Dietetics was founded over 100 years ago. We hold accreditation through the Accreditation Council for Education in Nutrition and Dietetics. And our program mission is that graduates of the program will be adequately prepared to pursue positions as entry-level registered dietitian nutritionist. They will be able to begin professional practice with a solid background encompassing the breadth of the field of dietetics. Their depth of knowledge will allow them to provide quality of service, effectively apply knowledge, and provide a continuous systemic approach to evaluating outcomes. The graduate will be able to base their practice on significant scientific principles and best evidence. Our graduates will be competent entry-level dietitians, and they will be empowered to conduct research, and both the internship graduate and the graduate employer will understand the impact of completion of a program focused in research processes and applications. So our program outcomes really do reflect success. We have a solid track record, which is evidenced by our graduates year after year who have been able to pass the RDN exam on the first attempt. In addition to our solid first-time pass rate, 100% of our students have successfully completed our dietetic internship program. 100% have ranked themselves in a postgraduate survey as having felt prepared to enter the field as indicated by a survey score of satisfactory or higher. 100% of our graduates find employment within 12 months, and many actually find or secure employment even sooner. And 100% of employers who hire our graduates rank our UH graduates as performing at a level of satisfactory or higher. So not only do we have great outcomes, but we also have top-notch preceptors at university hospitals. You will see here that the majority of our internship preceptors are dietitians, and they also hold advanced degrees or certifications. Many of our preceptors are past graduates of our program, which signifies what a great place UH is to be at. Our preceptors are heavily involved in our professional organizations at the national, state, and local level, And in addition, we have several dietitians on staff who are national facilitators for the nutrition-focused physical exam training put forth by the Academy of Nutrition and Dietetics. And I just want to note here, too, that being a large academic medical center, our students not only learn from their preceptors, but they're also learning alongside medical residents, nursing students, and speech therapy students, just to name a few. So it really does go beyond dietetics. Next, I want to review our dietetic internship program timeline. Our dietetic interns complete 49 weeks of supervised practice. This begins with a 2-week internship orientation based at UH. Then each dietetic intern continues on in a different rotation sequence for the remaining time. In the first phase of the program, which you'll see highlighted in yellow, they all are completing their medical surgical rotations and their food service rotations, and then going into the second half of the program, which starts more in the spring or in January, they move into those more advanced specialty rotations. And of note, our dietetic interns work with their assigned preceptors one-on-one, which allows for much individualized attention. In mid-June, all 5 dietetic interns then simultaneously begin the grand finale of the dietetic internship, staff relief. During staff relief, each dietetic intern chooses a preferred floor, which they will oversee for 4 weeks to get a real-life feel of what it will be like to function as a primary nutrition provider. At the end of staff relief, the intern is then provided with the dietetic internship verification statement, which allows them to move forward with taking their registered dietitian nutritionist exam. So you'll see many of our students then go into that final semester case having already taken their registered dietitian nutritionist exam. So in the next slide, I've overviewed some of the details regarding our general and specialty rotations, and you'll see that our program is definitely heavy in clinical nutrition, still leaving adequate time for food service and community experiences. Of note, our dietetic internship does include one of the longest pediatric rotations available, which encompasses 8 weeks working in our Rainbow Babies and Children's Hospital. Throughout our dietetic internship program, there is a multitude of opportunity for interdisciplinary education at the hospital site. You'll see our dietetic interns get to participate in wound rounds, observe a feeding tube placement, modified barium swallow study. They also actively participate in our multidisciplinary rounds, committee meetings. They facilitate our journal club, and they also get to be engaged in quality improvement initiatives. There are many opportunities during our program which allow the dietetic interns to get creative and think outside of the box. The next couple slides, I just included some photos from some of these experiences. So here during the month of March, our dietetic interns have 1 week dedicated to providing National Nutrition Month outreach on campus and in the community. As a group, the dietetic interns also lead and organize our on-campus National Nutrition Month Health Fair, which involves each dietetic intern creating a nutrition-themed booth and facilitating an activity during the fair. For the past few years, we've also been able to include an experience in our on-site UH Media Studio, where the dietetic intern gets to complete a nutrition-focused segment for a local news channel. This opportunity has been made available by means of our UH dietitians, who also serve as our UH and Academy media representatives. There are various community outreach opportunities the interns are involved with throughout the 49 weeks, each being led by one or multiple dietitian preceptors. Our dietetic interns have enrichment experiences, including visiting our local hydroponic greenhouse and a locally operated dairy farm. Our interns volunteer at the Greater Cleveland Food Bank annually and also help facilitate a on-site food pantry, which provides low-cost or free produce for our underserved communities. So finally, I want to highlight some general facts about our program. Again, we have 5 full-time dietetic intern slots annually. We provide a $13,000 stipend, which is dispersed as a UH paycheck, in addition to a $1,000 meal stipend, so $14,000 total. In addition to the cost of case tuition and fees, UH parking is optional and can range from $45 to $50 per month. Interns have 6 holidays off and are allowed up to 5 personal days. And there is a 2-week holiday vacation during the month of December. And there are several opportunities throughout the program to attend professional meetings. And here I've overviewed some of our admission information as well as details regarding the match process. We do accept candidate applications through DICAS, and we participate in the D&D Digital Spring Match. UH Cleveland Medical Center is program number 367. And I do want to mention that we will have a live on-site open house on Friday, January 4th. I invite each of you to our campus so that you can see if you picture yourself at UH Cleveland Medical Center. Additional details can be found on our website. In conclusion, I would encourage you to visit our program website and feel free to reach out to me directly with any questions. Thank you and good luck, and now I will turn the program over to Mrs. Allen.
Hi, everyone. Thank you very much for your interest in all of our programs this evening. The VA Northeast Ohio healthcare system is the 3rd largest VA healthcare system in the country, serving more than 111,000 veterans per year. The Lewis Stokes Cleveland VA Medical Center serves as the hub for veteran care in the area, as well as the main rotation site for our VA dietetic internship. Healthcare is provided to veterans at our main campus in Cleveland, as well as 13 community-based outpatient clinics, a freestanding dialysis center, and an ambulatory surgery center. Dietetic interns spend the majority of their time at our main campus in Cleveland, but they do also spend time at our Lorraine and Painesville home-based primary care clinics and our Parma outpatient clinic. The Lewis Stokes Cleveland VA has many accomplishments, including we were the first VA to receive certification for inpatient diabetes care from the Joint Commission, the first VA to be designated as a ventricular assist device implantation referral site, and as well as the first VA to be recognized by the ALS Association as a certified treatment center of excellence. The Lewis Stokes Cleveland VA is also a national and regional referral service for many various areas of medical care. We have dietitians practicing in all of these areas, so our dietetic interns have the opportunity to work in these specialty areas while in the internship. The mission of the VA, as all of you know, is to care for veterans. The secondary mission of the VA is to provide healthcare education to all types of healthcare professionals, medical residents, pharmacists, dietetic interns, social work students. So the VA contributes quite a large budget to that over the course of the year. As you can see, the VA training budget was approaching $3 million in 2017. Here I've included a couple of pictures of the VA dietetic intern suite. Each dietetic intern at the VA gets at their own desk, a desktop computer, as well as a locker to use while on site for rotation. The mission of the Lewis Stokes Dietetic Internship is to provide a foundation in research and evidence-based nutrition practice, interdisciplinary team experiences, and broad exposure to specialty and advanced level practice in order to prepare our graduates to become entry-level registered dietitian nutritionists with a Master of Science degree in nutrition who deliver competent nutrition care to veterans and the public in a compassionate and ethical manner. And here I've included a photo of our medical center, our long-term care wing of our hospital. The goals of our dietetic internship is to make sure that interns who graduate from our program are able to be employed in nutrition therapy, community practice, food service, systems management, or research in government, public, or private sectors, as well as they feel comfortable participating in research, and we make sure that we evaluate the impact that the research concentration has on their careers and employment. All objectives for our dietetic internship are met with 100% of our graduates completing the program within 12 months. 100% of our graduates are employed within 12 months, and many are employed before 12 months. 100% of our graduates take the exam within 12 months of completion. We have a very good pass rate with 83% passing on their first attempt within 1 year. And 100% of employers rate our graduates as performing at or above entry-level practice when they're hired. The Cleveland VA has the largest staff of clinical dietitians in the VA system, serving in community and hospital-based clinics, inpatient areas, diabetes self-management, education and support, dialysis, home-based primary care, food service, systems management, and administration. Many of our dietitians on staff are graduates of the Lewis-Stokes VA, and 91% of our dietitians have a master's degree. Our staff has gone on to get additional certifications, and our dietetic interns are able to rotate with these dietitians and get the expertise from their certification specialties. The internship is a 49-week internship. Interns spend time in clinical nutrition management. Clinical rotations include medicine, surgery, nutrition support, renal, and oncology. Community rotations include cardiovascular risk reduction, the ID infectious disease clinic, diabetes self-management, education and support, as well as the women's clinic and others. 8 weeks are spent in food service systems management. We do have a pediatric affiliation with University Hospital's Cleveland Medical Center. Interns are allowed a 2-week enrichment rotation of their choice, and we do conclude with a 3-week staff experience where interns get to choose an area where they would like to spend 3 weeks and solidify all the skills they've learned throughout the course of the internship. Throughout the internship, we do go on various field trips. We do sometimes collaborate on those field trips with University Hospital Cleveland Medical Center, as well as the public health internship. We do farm-to-fork tours as well as industry tours, and it can be a nice way to enrich the curriculum. For the enrichment experience, which is 2 weeks, the interns can choose from various venues such as our Healthy Teaching Kitchen, group home inspections, working at the Greater Cleveland Food Bank, or in WIC, sports nutrition, or private practice. Some of the benefits of being a dietetic intern at the Lewis-Stokes Cleveland VA is our stipend is $15,000 over the course of the 12-month dietetic internship. Our research concentration helps interns gain critical thinking skills and sets them up for their jobs. The majority of our rotations are a one-on-one dietitian to intern ratio with minimal simulation or shadowing. The interns do a rigorous hands-on rotations in clinical, community, and food service systems management. The fact that we are combined with the master degree program at Case Western Reserve University is also a strength. And upon program completion, dietetic interns have preferred hiring status with a national employer. I have included here my email address if anyone has any questions. I would also like to let you know that we are having an on-site open house on January 4th from 1 to 3. And if you are interested, please feel free to RSVP to me and let me know. And thank you very much for your interest in our program.
Thanks, Mrs. Owen. So I'm going to unmute all of your presenters this evening. And now is the time that if you have any questions, please do use that chat box and type in your question, and I will make sure it is answered by the appropriate program director, faculty member, whoever is the right person to answer. And it looks like as of now, we don't have any questions. Oh, there's one. Thank you for hosting this. I was wondering if there are any graduate assistantship positions available. So that's either Dr. Hand or me. You want me to take it, Dr. Hand, or do you want to?
Go for it.
Okay. So we're a pretty small department in a fairly small school. And so the bottom line is pretty much no. And the reason for that is twofold. One is we don't use TAs or GAs or anything like that to teach courses. They're all taught by primary faculty or adjuncts who have an area of expertise in the subject that they're teaching. And then the other thing is the interns really and truly don't really have time to be doing anything else. Because this is a program that many, many schools do in 2 years or even 2.5, and we do it in 16 months, there isn't a whole lot of time to be doing much else. So we do not have a lot of opportunities. We have 1 or 2 graduate students a year who do a couple things around the department, but I would not go as far as to say there are many opportunities for graduate assistantships. Next question. Specifically in the public health program, is there a common quality found between all your interns? And what quality are you looking for in a future intern? So for the public health program, what am I looking for? I'm looking for students who want an experience outside of the 4 walls of the hospital. For someone who knows that they want to be in a clinical program, this isn't the right program for you. You do a clinical rotation, but it's much shorter than the clinically based programs. We have a lot of students who may not necessarily think that their heart is in public health and community nutrition, but they know it's not in clinical. And so I think what I'm looking for is open-mindedness. And so is there a common quality among our interns? Yeah, it's kind of being open-minded and flexible and willing to keep their options open as they go through the program. Let's see. Next one. Good evening. During my conversation with me, I indicated that there was an opportunity for culinary nutrition medicine. Can you elaborate on this? Okay. So we have a culinary medicine program that is offered through our department to our medical students, and we are trying to figure out a way to have our interns have an opportunity to participate. So can I elaborate? Not exactly yet, other than by next August when all of you start, there will be some opportunity for probably in my program an elective rotation working with that program. I hope that's enough of an answer. Next question, when is the GRE required? Is it on February 15th? Yes, for me, for the public health program, the GRE is required. It is not required for, correct me if I'm wrong, it is not required for university hospitals or the VA, but for the public health program, it is required, and yes, on February 15th, when you submit your DICAS application, you'll need to put in your GRE scores. Next question. Oh no, they're going too fast. Okay. Due to the fact that applicants are automatically, here's another GRE question. Due to the fact that applicants are automatically accepted into grad school, is the GRE required? Yes, because it's taken into consideration when we're evaluating the DICAS apps. And again, not for university hospitals or the VA. Sorry, there's more questions and it keeps scrolling. Okay. So this one doesn't say specifically to who, so I'm going to let somebody else answer it. What do you find most valuable in reviewing an application? Mrs. Allen or Mrs. Bayless, anybody want to tackle this?
Sure, I will. I was just going to say that for university hospitals, we do really like to see in the personal statement something, about our hospital or why you're interested in being an intern at university hospitals. So something that kind of like individualizes the personal statement to show that you've researched where you're applying and you do have a specific interest in our site. And then as well, in letters of recommendation, make sure who you're asking that they know you well and are able to speak on your behalf because it is really important having these people recommend you for your dietetic internship because I'm sure at this point you realize it is a very important piece of your career path. So, Ms. Allen, do you want to add anything else to that?
And I would agree with that, and I would also say if you are interested in the Cleveland VA, we do have on our website specific items we'd like you to address in your personal letter. We have a couple of questions that we'd like you to incorporate into in your personal statement. Thank you.
And I'll just add my 2 cents worth. I agree that the personal statement for the public health program is really important. That's our opportunity to get to know you, so make it good. Okay, as a student not from Cleveland, I am curious where most interns choose to live during the program, on campus at Case or close to internship sites. Mrs. Allen or Mrs. Bayless, do you want to make a generalization about where your interns live?
Yeah, I would say that the majority seem to live nearby campus, so not necessarily in the student housing at Case, but there are many options for apartments and townhouses, like various areas very close to campus within walking distance. I would say that's the preferred housing area. So as you're looking at areas like Coventry, Little Italy, and if you guys want to add any more.
Yeah, just to clarify, if you're not from Cleveland, this is an important question. So all 3 of the programs that we're talking about are in very close proximity to each other. So University Hospitals is right next door to Case Western Reserve University. They're actually connected to each other by a tunnel. And then the VA is just 5 to 10 minute walk further. And so wherever, if you choose to live near Case's campus, you'll also be choosing to live near the 2 hospital sites at least. It gets a little bit more complicated with the public health nutrition program, but most students are pretty happy to find housing near campus and also near the hospitals. And Professor Randall, I wonder if you want to go to the next slide also to leave so students can see the program information while we chat about the questions.
Thank you for that reminder. And just one more comment about housing. Case does not have much, if any, graduate housing. So everyone lives off campus. But because we have a dental school, a medical school, a law school, and 4 large academic medical centers, very, very, very close proximity, there are plenty of apartments very close to campus. So housing is not a problem.
And I was going to share, too, after the match takes place, we typically exchange lists of current graduates, and they help to kind of guide the incoming graduates on good places to look for housing.
We do the same thing. Good point.
Yeah, so it's helpful because it's a big city.
Yes.
And the VA does that. Yeah, I just wanted to add the VA will also match current interns up with incoming interns, so there's someone they can ask questions to. So thank you.
And it looks like there's just one more question, and it's for me about public health program. Is there an average GRE score among interns? If there is, I don't know what it is. I don't have a minimum. I use it because it's just an additional factor to evaluate students. So I don't honestly know if there's an average. If there is, I haven't calculated it. I have one for Mrs. Bayless. For UH, is the required DPD science GPA still 2.75? How is that ranked in comparison to DPD professional and cumulative?
Yes, the science GPA minimum is still 2.75, and then the other GPAs are 3.0. And we really take all into consideration. We do look closely at the science GPA just because it correlates so closely with the critical thinking and our more advanced rotations.
Thank you, Mrs. Bayless. And I don't see any more questions. I'll give it another minute. As you see on this slide, you have the program numbers for all of the programs that we talked about this evening, both the websites, the contact person, as well as that program number when you are applying or ranking for D&D. And I still don't see any more questions. So with that, unless any of the other presenters have anything else to say, I will thank all of you very much for participating this evening. Look at that, it's 7:57. We're almost right on the dot for an hour. If there's anything that you heard this evening that you want to be able to hear again, we are going to post the recording of this webinar on all of the program sites. It takes a couple days, maybe even up to a week for that to happen, but it will be available if you would like to listen to it again or specific parts of it again. So know that that will be an option. And without further ado, I don't see any more questions. I wish all of you happy holidays, happy New Year, and we hope to see some of your applications after February 15th. Have a great evening.